Good morning, ladies and gentlemen, and welcome to the Kingsbury Hotel and seminar on global health histories. It is sponsored by the WHO Regional Office for Europe, the WHO Collaborating Center for Global Health Histories at the University of York, and today's topic is strengthening universal health coverage for the fight against antimicrobial resistance. It will showcase the deliberations on recent historical experience and contemporary practice. And this seminar seeks to create a better understanding of the nature of universal coverage in Sri Lanka, with special reference to one of the enormous challenges in the future, namely the rise in resistance to antibiotics and other antimicrobials, which poses a significant threat to both human and animal health. So we will, through this seminar, trace the interconnections between reform in universal health coverage and Sri Lanka's role in expanding the United Nations and the World Health Organization. The panelists will consider the challenges facing the provision of health quality, free health care to all, the financial, the political, and the health challenges posed by antimicrobial resistance, and the need for novel health financing strategies to change pharmaceutical and antibiotic supply and usage. This seminar is actually the first step towards a broad-ranging coalition founded on the basis that Sri Lanka has an important global role to play in strengthening universal health coverage and combating antimicrobial resistance. It's my pleasure to invite to the head table Dr. Anil Jasinga, Deputy Director General, National Hospital of Sri Lanka; Dr. BVSH Beneragama, Deputy Director General, Laboratory Services of the Ministry of Health, Nutrition and Indigenous Medicine; and Professor Sanjoy Bhattacharya, I hope I got that right, a Professor in the History of Medicine and Director of the Center for Global Health Histories, University of York. I will now invite Dr. BVSH Beneragama, Deputy Director General, Laboratory Services, Ministry of Health, for the opening remarks.
Good morning, everybody. Dr. Reggie Perra, one of our former secretaries and also one of our teachers in medical administration. First of all, I would like to thank Dr. Suranga Dolamulla for inviting me to attend this important workshop or seminar. Of course, here we are talking about the universal health coverage and the antimicrobial resistance. Those two areas are very, very important when we talk about the health of a nation. Sri Lanka has been doing well for last so many decades because of the free health care. Though we call it free health care, or we say that there is no direct cost or out-of-pocket payment at the time of service delivery, of course, this is the health services maintained by mainly the taxes collected from each and every person of this country. And also, I think government is planning to to make the things right by improving the collection of direct taxes and then reducing the burden of ordinary people in the long run by bringing down the indirect tax. That should be the way, but unfortunately it's happening the other way at the moment. By development, you improve the choices of people, you improve the capacity to choose by the people. The beggars can't be choosers, but when you are economically sound, especially, you have a choice. But development does not mean economic development or reduction of poverty or increasing the income by way of financing. You have to have certain other conditions which should be fulfilled for a population to be called healthy. If you want to use the income you gain fruitfully, you must be educated. So education is part of or result of development. And also, to enjoy what you get, you must be healthy. Then there should be an environment where you can have freedom to talk, human rights, women rights, equity is the other thing. If all these parameters or criteria are fulfilled, we can call that country is a developed country. So in that scenario, you would see that there is a symbiotic or interrelationship between the outputs and inputs of development. Therefore, you can't detach these two and talk about the health. To make a country develop, you must have a healthy population where people should be accessible to universal health coverage at an affordable price with good quality. When you talk about this antimicrobial resistance, realize the importance of combating antimicrobial resistance, and if we don't do that, the bad health impacts the entire globe would face. Already the WHO has recognized this as one of the most serious threats to the health of the public. Therefore, World Health Assembly has passed resolutions starting from 1998 up to 2015 or 16. And also we are a signatory to the Jaipur Declaration in 2011, and we are bound legally to follow these WHO resolutions because a threat to health by antimicrobial resistance is not something which could be contained by one country. If we in Sri Lanka is not taking adequate correct measures to contain antimicrobial resistance, that would have bad impacts or effects on the entire globe due to migration and other factors. So we conducted seminars in many parts of the country for doctors and other healthcare workers who have a stake in this issue to make them aware about this global threat. Anyway, as you all know, this is something which has to be addressed through multi-sectoral approach. There are main sectors which are having a stake in this exercise are human health, agriculture sector, fisheries, veterinary, and so on. So under One Health concept, we have brought all those four sectors together. And about the College of Microbiologists who has initiated this work before I took over this position as the DDGLS. And with proudness, I would like to mention that DDGLS is the focal point for antimicrobial resistant containment in Sri Lanka. It has been accepted by the WHO. So it's my duty, and it's the duty of the Ministry of Health and all these four sectors to work together and address this menace. Otherwise, we will be without effective antibiotics in very near future to come. With this objective in mind, we set up a national advisory committee comprising of policymakers, chaired by Director General of Health Services. I am secretary to that committee, with the involvement of all these sectors, the professional colleges, and we work hard for nearly 1 year to prepare the National Strategic Plan on Antimicrobial Resistance. And we were able to launch it in last May. Sri Lanka is the second country in this region who have published or come out with a plan of action, strategic plan in this regard. The main emphasis are on communication or making aware the stakeholders or the players who are playing with antibiotics. Then of course infection prevention and control, research and development, making the available antibiotics are of good quality, safety and efficacy, and so on. There's another committee called NAPIST, National Advisory National Action Plan Implementation Strengthening Committee team. So we are regularly meeting, and now we are working on the activities. While carrying out activities, we are in the process of establishing a surveillance system with the support of the WHO. Of course, at the moment there is a surveillance system. Therefore, to plan our programs and also to monitor, evaluate our programs and then replan, we need very strong surveillance system. As I have been involved in the Drug Regulatory Authority, I am very well aware that the number of antibiotics which are coming to the market new are very, very much less than what it was. Therefore, they are gradually moving away from invention of antibiotic. Therefore, it's very timely that we get together, discuss about this topic. So, all in all, we have to get together, take this as a serious issue, work as a team, not only health. Each and every individual in this country has a role to play. When it comes to antibiotics, Sri Lanka is spending around 4 billion, 12.7 of the drug budget, and mostly these are in the way of foreign exchange going out of the country. It's a financial burden. When there is a multi-drug resistance or the resistance, there's a long hospital stay. Thank you very much.